Dentists told the whole truth about wisdom teeth. Should they be removed? Dentists told the whole truth about wisdom teeth, or as experts call them, eights. It turned out that a person does not have to go to the dentist for removal. People can be fine with wisdom teeth if they are healthy, don't bother you, have erupted completely and correctly, and are easily accessible for cleaning. In some cases, dentists recommend immediately getting rid of the eights. Firstly, you need to contact the dentist if there is insufficient tooth eruption, pain and swelling of the jawbone or gums, and the risk of developing caries. Secondly, the removal of wisdom teeth is recommended when the teeth are incorrectly positioned, for example, with the root to the side. Due to pressure on adjacent teeth, the entire row of teeth can be displaced. In severe cases, surgery may even be required. Recovery after the removal of the eights usually takes about 2 to 3 weeks. During this period, the dentist may prescribe painkillers and anti-inflammatory drugs. But if the wisdom tooth does not give you any problems and you feel good, then you can forget about this problem. Everything you need to know about wisdom teeth. When are wisdom teeth cut? Wisdom tooth, colloquially, 8, is called the 8th extreme tooth in the dentition, or the third molar. It got its name because it grows last. When a person reaches intellectual maturity, he becomes wise. Many are sure that the appearance of eights does not depend on how old a person is. This is a misconception. The roots of the wisdom tooth begin to form at the age of 15 to 17, and the wisdom tooth itself grows on average until the age of 25. Sometimes it erupts a little later or a little earlier, and sometimes it does not appear at all. But if you are already 27 years old, and there are no wisdom teeth yet, it is definitely not worth expecting that someday they will erupt. Older patients who went to the dentist thinking they were cutting a wisdom tooth most often suffered from pericoronitis. This is the name of the inflammation of the part of the gums, which, like a hood, covers a half-cut tooth. Why do people need wisdom teeth? We inherited wisdom teeth from our distant ancestors, who ate mostly hard and hard food. To chew it, powerful jaws were required. Over time, human nutrition has changed. Today we consume a lot more thermally processed foods. The softening of the diet led to the fact that the eights lost their original function, and the jaw itself decreased. In the modern world, primary adentia of the third molar is increasingly observed, that is, a situation where the rudiments of wisdom teeth are not formed. According to statistics, approximately 92% of adults have the maximum wisdom teeth provided by nature, that is, 4 pieces. In 25% of humanity, third molars remain under the gum. And approximately 8% are not observed even in the embryonic state, which indicates not a pathology, but only an individual feature. A significant part of modern scientists believe that large extreme teeth are a useless vestige that creates too many problems, and the best solution is to remove the wisdom tooth at the initial stage of its formation. However, experts also note the useful functions of the eights. For example, they protect neighboring teeth from loosening and creating gaps in which food can accumulate. In addition, it is to the large extreme teeth that a bridge is sometimes attached. What complications can wisdom teeth cause? Most often, wisdom teeth grow with complications. They can be displaced, tilted, or incompletely erupted, causing inflammation of the bone and gums, breaking the bite, injuring the inside of the cheek, and destroying the teeth with which they come into contact. The main cause of complications is the small jaw, which simply cannot accommodate the maximum number of teeth. It is the lack of space that causes crowding of the teeth or their retention, semi-eruption. Third molars are born when the growth of the jaw bones gradually fades away. Therefore, wisdom teeth simply have nowhere to grow. Eruption of the wisdom tooth, in addition to general discomfort, pain, swelling of the gums, fever, in 80% of people provokes purulent inflammation, which can be a real danger to health and life. The gum around the cutting wisdom tooth takes the form of a pocket with a hood, under which plaque, food debris, and bacteria accumulate. This causes festering and an unpleasant odor. In addition, the third molars occupy the last, most inaccessible place on the jaw and are often poorly cleaned during hygiene procedures. This contributes to the development of caries, which often passes from wisdom teeth to other teeth. In order to prevent complications associated with teething of wisdom teeth and bite, I strongly recommend visiting an orthodontist. He specializes in correcting bite. Wisdom tooth, remove or treat. If the third molar has grown correctly and is only affected by caries, it is quite possible to treat it. Although the inconvenient location makes it difficult to treat a wisdom tooth. In case of more serious complications, it is better to discuss the expediency of medical procedures with a doctor. Should wisdom teeth be removed? If there is no room left in the jaw for another tooth, the third molar will have to make its way, crowding out competitors, adjacent teeth. So, complications are inevitable. In this case, the best way out is the removal of the wisdom tooth. Can wisdom teeth problems be avoided? Of course you can. To do this, it is enough to go to the dentist once every 6 months for a professional hygiene procedure and once a year for a preventive examination. If your wisdom tooth is bothering you, your gums are inflamed, or your doctor has found problems with the dates at an early stage, follow his recommendations and be healthy. Thank you for watching. Make sure you like the video and subscribe for our new content. Click the bell sign to stay in contact with updates from us. Don't forget to check some useful links in the video description below. Hope see you back on Lify Life.